Hi, my friends. Today we will discuss gross description. My name is Samih Mikhail, and I am a pathology resident. And this is the Pathway channel. Please like and subscribe. So for general principles of gross description, we have 5 points to be fulfilled. First, you should mention the patient name, the specimen label, fresh or infexitive, anatomic structures with dimensions and weight. Number 2, description of the main lesion, type, size, relation to normal structures, and margins. Number 3, describe any secondary pathology that you will find by chance, like any incidental polyps or ulcers. Number 4, list the frozen sections, any photographs you took, and any special study that were done. And lastly, fifth, list all cassettes and type of tissue sampled. An important note here, please ink the tissue before cutting. So, the components we use in gross description, measurements, we use centimeters and fractions of centimeters like 3.2, like 4.0, and they are expressed in numbers, not letters. Tumors will be measured to the nearest millimeter, and this size will be used for staging and diagnosis. For the numbers, be specific as much as you can, giving accurate numbers. Weight expressed in grams. All solid organs are weighted before fixation. So the weight is taken on the preparation day, 1 day before crossing. Color is helpful in describing the specimen, especially if normal color of the tissue or organ has been altered. Some tumors or tissues have characteristic colors like the renal cell carcinoma is golden yellow, which will help later in the microscopic diagnosis. Consistency can be helpful describer in communicating whether or not there is a malignant lesion present. Most tumors tend to be hard than the surrounding tissue, but this can be changed if the patient received treatment. Shape and texture, malignant processes usually have infiltrative and irregular borders. Again, this will help the pathologist identifying the lesion. Smell may indicate decomposition of the tissue or delayed handling of the specimen. In completed pathology report, gross description and microscopic diagnosis should be in agreement. So let's take one sample dictation. Number one, as we mentioned, you can relate this slide to the previous slide mentioning like the 5 stages of gross description. So here, number one, we will say specimen container is labeled Superman, Batman, whatever, and right thyroid loop. Suture marks right superior thyroid. Received in formalin is a total thyroidectomy consisting of right loop 4.9 times 3 times 2, left lobe 3 by 2.4 by 1.2 centimeters, and then this is like superior to inferior, medial to lateral, and anterior to posterior. Then number 2, we will go to describe the main lesion. So within the left thyroid loop, there is a dominant lesion. Again, the measurements, well circumscribed, tan yellow nodule, abuts the superior, anterior, and posterior margins with areas of hemorrhage and necrosis. Number 3, any additional finding. Within the right loop, there is a white, fully circumscribed nodule, and this is the measurement separated from the kind of first nodule by this measure and 0.2 centimeters from the posterior margin. Number 4 and 5, 4, the specimen is photographed and photos uploaded to the system, and then the list of cassettes like cassette A1 has the slices 1 and 3, cassette A2 to A5 has the nodule representative section, and A6 to A8 another representative section. I will post more sample dictation videos for colon, gallbladder, appendix, other organs as we go. So please like and subscribe to receive more videos, and thank you.